to a doctor about this. Is it really safe to let a 16-month-old swim on her own? Here to weigh in, Dr. Jennifer Caudle. She's a board-certified family physician. Doctor, thank you so much for coming in. I mean, the video is amazing, and clearly, Elizabeth, it looks perfectly fine and happy to be in the pool. What is your take on this? 16 months old. She was trained by a certified swimming instructor. What do you think of these survival swimming skills for children at that age?
Well, the question about is this child safe to be doing this in swimming really has to do with the individual child. Now, if the child didn't know how to swim, they weren't properly trained, clearly this is not a good idea. But in the video, we see this little one swimming across the pool, so she clearly can swim. You know, it's amazing. Babies and infants can have amazing talents and skills, and that's something to be really lauded and taken into account. And we also have to take into account the fact that the parents did say on the YouTube video, one is a nurse, one was trained in lifeguard skills, they have CPR training. We really have to look at that entire context and that whole picture to actually determine if this is right for a child or not.
Do children at that young age have that instinct to come up to gasp for air?
They can. They absolutely can. And again, this depends on the personal child. It depends on their experiences, how they're trained, their family environment. There's so much that goes into this. But, you know, I have to say, I watched that video, and it is quite amazing and quite compelling.
Yeah.
You know, as a physician, I always like to err on the side of caution and safety. This is the thing that I think about. I personally would like a parent or guardian to be very, very close to that child just in case. But safety is utmost importance, and to really evaluate it, we have to look at the entire picture.
Yeah, every family has to be careful, but little Elizabeth seems to be enjoying it very much. I want to move on to a very different topic, but one that is no less important. The first FDA-approved non-hormonal drug to help treat hot flashes. This is music to the ears of millions and millions of women. What's your take on this drug?
Well, let me tell you this. If I had $1 for every time a woman told me that hot flashes were the most horrible thing in the world, I would be a very rich woman. Hot flashes affect so many women.
They're the worst. I think I was having them yesterday.
Really? 75% of women who are in menopause have hot flashes. There are these rushes of hotness, sometimes can make women sweat or have palpitations. They can happen during the day, at nighttime. Honestly, I think...
So what's this drug going to do for that?
Well, this is the issue, is that first of all, in terms of drug treatments, we've only been limited to hormonal treatments. In other words, the only medications that we have right now that are FDA approved to treat hot flashes are based in hormones, estrogen, progesterone, or a combination of both.
And that's caused some concern. There have been some increased risk for cardiovascular issues with that.
Well, I'm so glad that you know that. The drugs work very well, but there are these risks. And just as you mentioned, risks of increased cancer, actually, heart attack, stroke, even blood clots. So the fact that we have a non-hormonal FDA-approved treatment, I think is a big deal. I really do.
A safe alternative.
A safer alternative, or let me put it this way, actually, an alternative that's appropriate for more women. Because it's about finding the right drug for the right woman.
All
Absolutely.
right. Good news for many women today. Doctor, great to see you. Thank you so much.
See you.